In this video, we're going to talk about mental health after pregnancy loss or complicated pregnancy outcomes. Um, the loss of a loved one is earth-shattering. The loss of a child is uniquely painful. Parents, you're carrying this pain in ways others may never fully understand. As we speak of loss, we are including pregnancy loss across all trimesters and all infant loss. We recognize loss after miscarriage, or termination for medical reasons. We recognize stillbirth. We recognize loss after birth, whether tied to incompatibility with life, expected or unexpected neonatal complications, or other natural causes. Loss should always feel uniquely yours and your partner's. And if you're living through this, we just want to stop and say we are deeply sorry, and our hearts go out to you. We're here to provide help, and if you're open to it, we'd love to hear your story.
At CarryMe Health, our new member welcome space is where we hear stories and share them in community. Member connections can also be made across the community based on similarities in your story or that your bio that you create on the CarryMe Health community platform. And that could include location, fetal diagnosis, and whether you have living children or not. You can also share a short version of your story in your bio. As with navigating OB and fetal care appointments, loss brings overwhelming decisions like how will delivery happen? How do we want to honor this baby? Will we take keepsakes? What paperwork is required? Will we try again? First, don't rush decisions that can wait. You're not supposed to have all the answers. This is an unfathomable experience and it can take time to find those answers. Each day and even each breath feels like a mountain of its own.
Perinatal loss can challenge your sense of safety, identity, and your future. Research shows up to 60% of parents experience post-traumatic stress symptoms after perinatal loss. There are many statistics on the frequency of loss, especially in the context of a known fetal diagnosis. But friend, we are here not to share just statistics, but to truly hear your story. You and your baby's story can be carried forward. With support, you can find light where there may be present darkness. Hope and healing will come after grief and loss. You do not have to carry this alone. With compassionate support, safe spaces to grieve, ways to memorialize your child, and connections to others who understand, healing will come.
Community and therapy are available if and when you become ready for these. We're not meant to go through pregnancy or infant loss without community. If you're feeling alone and ready to connect, please reach out to us. A therapist offers a safe place to bring the scary and difficult details in a confidential, safe space. Our videos on relationships with your partner, other children, and others, available mental health resources, and trigger videos are all helpful in light of loss. And we hope you'll circle back on any of those other videos if you've experienced loss. In addition, we want to talk through a few of the many ways you can memorialize this time and your baby's memory.
Thanks, Dr. Diana. So the first is naming baby. If you're able, we encourage naming your child. We've seen this to be an important piece of the healing process for many families. A name says that you are here, you're part of our family. It honors your child as a person and marks a shift toward reflecting on life, however short. Names can be formal names or nicknames that perhaps you used in the womb before or during after fetal complications. Some choose a private name and others share this with close family. All of these choices are valid.
Honoring key dates. Grief doesn't follow a calendar, and if you've lost a loved one, you certainly know this. But with a baby, common dates to honor are the original due date or the actual birthday, Mother's Day and Father's Day, the day your baby died, or the day that holds the what should have been for you. And honoring these special days can take the form of lighting a candle, writing a letter, journaling, visiting a meaningful place, or simply allowing yourself to rest.
Keepsakes can also be powerful anchors for memory and connection. So these could include handprints or footprints from the hospital, photos, blankets, clothing, or name bracelets, memory boxes, letters, weighted bears, gifts from the hospital, ultrasound photos, a Christmas stocking or ornament, a book, or jewelry. Some parents want to keep keepsake right away. Some decide they aren't ready, and that's also okay. There are ways to memorialize this baby through keepsakes that are truly personal to you or that are shared outwards. So transitioning from keepsakes and ways to memorialize your baby's memory, we also want to cover immediate grief navigation.
In the early days after loss, many parents are still in shock. And when asked to make decisions or discuss topics that have long-term impact, they're still reeling. These decisions can include the type of delivery, whether to hold the baby and for how long, cremation or other type of burial planning, meeting with a social worker or bereavement services while they're still in the hospital, whether or not to have an autopsy and exactly what type of autopsy. And there are so many other decisions that can happen in this immediate shock phase.
It's okay to pause and receive help and delay any decisions that can wait. Time can really help determine what is meaningful to you and what's best for your family. So ask whether it's a decision that can be made now. Ask the clinical team or in whatever context you may be, can this wait? Does this need to be decided right now? And for decisions that cannot wait, speak with your partner or family first if that's helpful to you. Hospital resources like social workers, chaplains, and bereavement coordinators will be there to guide you. They can also suggest similar resources to what they offer if you prefer to use services like theirs, but at a later date outside of post-discharge. Lastly, there are many questions that you can ask your doctor in light of pregnancy or infant loss. We have a guide on questions after loss, which we encourage you to download. Thank you so much for watching, and we encourage you to revisit any videos in this mental health series that you haven't seen yet.